start by appreciating His Excellency the Governor, Dr. Kierio Badilisha, for making it possible and creating an environment which has enabled the department staff to work contusively. And why do I say so? Of course, to start with, as a department, we've come up with a 5-year strategic plan, which is anchored on the county investment plan. That is a 5-year county investment plan. This one guides us on what we are supposed to do on day-to-day basis. And we are measuring this because every year we are coming up with a performance contract, looking at the indicators, sales indicators, both financial and non-financial indicators, which are going to help us improve on the service delivery. We also develop annual development plans specific for the department to guide and also to measure our performance. Other than that, of course, we have the structure which we've put up under the Department of Health Services. We have an organogram headed by the CEC, and the department has 2 divisions. That is the division of preventive and promotive, headed by Chief Officer, and Department of Medical Services, also headed by Chief Officer. And then at the technical part, we have a County Director of Health Services, and under the County Director of Health Services, we have 3 directorates, namely Preventive and Promotive, Health Strategy Planning and Financing, and the Directorate of Curative and Rehabilitative Services. And this has helped us to cascade the necessary resources, the necessary activities which are supposed to help the department achieve their targets and their missions and vision. We've also been able to develop quite a number of policies. Currently, we are working on the County Health Bill, and this will be anchored on the national but customized to the Department of Health Services in Nyandarua County. We've been able to enact the County FIF Act, and we've developed the necessary regulations to help in implementation of that act. We take cognizance of the importance of human resource, and sometimes due to resource constraint, we may not have everybody we require, but we've come up with a locum policy which has been approved by the County Executive Committee to fill in the gap, and we must appreciate His Excellency the Governor for leading in this, because he wants the people of Nyandarua to get the best services ever. There are other policies and guidelines which have been worked on. Emergency response policy. Also, we are coming up with guidelines to see how we can have the resources in terms of the procurement guidelines, the finance budget implementation guidelines, and that is what we are doing in terms of leadership and governance. Other than the top governance, at the sub-county health level, we have sub-county health management teams, which are guiding the activities and the procedures and taking charge of the human resource at the sub-county levels. And then we have facility in charges. We have 2 hospitals, that is the JM Karuki Hospital and Engineer Hospital. And those 2 hospitals, they are governed by our Board of Governance. And we've done induction for the boards. We've also done induction for the facility committees, which also work hand in hand with the facility teams.